So hello, my name is Ravi Chana. I am the Executive Director of Diagnostics at ABHI, which is the Association for British Health Tech Industries. I'm joined today by Dr. Bernie Croal, President of the Royal College of Pathologists, and Professor Peter Johnston, who is the Vice Chair for Workforce and Corporate Engagement at the College. Firstly, thank you to you both for joining me today to discuss what I think is a critical topic affecting us all. So just for context, last year, the Health Foundation launched the NHS Productivity Commission, and the Commission put out a call for evidence and also published their initial report titled From Diagnosis to Delivery. And within the report, they've pulled out four main drivers that impact productivity. The first is workforce, the second is capital, the third is technology and innovation, and the fourth is transformation. And also within the report, the main headline of the report focused on the drop of in productivity within the NHS during and post-COVID. But to address the challenge, the government has set a target of 2% annual NHS productivity growth, which, according to a lot of experts, it's unlikely to be met within this timeframe of Parliament. Amongst the experts, there's a general consensus also that more needs to be done. And to achieve the target, there needs to be a collaborative and partnership approach. So really, my question is, from a pathology perspective, do you agree with some of the challenges that are laid out in the report? But also, how do people within the NHS, the Royal College, and industry work together to address some of these challenges? So with that, Bernie, if I maybe come to you first, and we can open up to some discussion as well. Thank you.
Yeah, I mean, certainly we've heard a lot of commentary from government and from Jim Mackey and Penny Dash and others around the so-called drop in productivity across the NHS. And you know, well that's true, there are probably good reasons for it. You know, there are lots of various bottlenecks and gridlock in the system, but also a lot of the goodwill has gone out of the staffing, and you know, that in itself has a big impact. For pathology, I'm not so sure whether our productivity has dropped. No one can really measure our output, and you know, and no one can really measure what pathology costs in the UK. So there isn't a good metric to really assess whether that is also the case in pathology. Certainly, most of our departments, anecdotally, have continued to increase the number of tests that we're doing year on year, with a very minimal uplift in budget, if any at all. So you know, it remains to be challenged if the assertion that pathology productivity has dropped is actually real. I would argue that it's probably improved and become more refined. You've also got to play into the factor that much of what we do has become much more complex. If you take histopathology, and I'm sure Peter will comment, you know, the complexity rise isn't counted in any productivity metric. Thanks. I'll hand over to Peter.
No, that's right. I think you're absolutely right, Bernie. I think, interestingly, we did a study which is now, it's ready to be done again, but we published it in 2012, and we looked at a set of histopathology specimens that were standard over a 20-year period. So we did 1991, 2001, and 2011, and we looked at the same specimens and what we did for them. And we found a metric which allowed you to look at the amount of information in these reports, which we found it doubled for most of the specimens. So the cancer resections, for example, all doubled in each 10-year interval because the data sets require more information. So if you look at it and say, you know, each of those is one specimen, but the amount of work to go into it to produce a doubling of the information every 10 years is a significant amount of work. And I dare say that since we did that study, it's doubled again because we've introduced molecular pathology into this field that we didn't have before. So although the number of specimens does not necessarily give us a particularly good handle on the work that's going in, I can say, just looking at the crude numbers, there's a continued growth in the number of specimens that come through pathology departments, histopathology laboratories, perhaps numerically less steep a rise than blood sciences, but nonetheless, that's if you just look at specimen numbers. If you look at request numbers, rather, if you look at specimen numbers, that's increased. If you look at block numbers, that's massively increased. And if you look at slide numbers, that's increased even more. So if you take the unit of work as the slide, then in fact, productivity has gone up because staffing hasn't gone up either in any of the categories of staff that we employ. And yet the amount of work that's being done to produce the same number of reports essentially has gone up dramatically. So, but underneath all of that, there still is an increase on, it's about 2 to 3% per annum of increased number of cases coming through. But the work that goes in behind them is massively increased.
So what clearly within the report, that's one of the things that's pulled out is workforce. And if the amount of work is increasing, but the workforce numbers isn't increasing, clearly there's a gap here, because if exponentially the amount of work is increasing, something needs to happen to make a change, to have a change. So what role is there for likes of industry to play within that? Is there a role? And then what else can we do to help address that issue?
Yeah, if I could start again, I mean, the assumption, I guess, is that the demand on the system is going to increase, and the demand versus the capacity is at the moment, not balanced, and that's why across various pathology disciplines we're seeing backlogs, we're seeing an increasing amount of work being pushed into the private sector from the NHS, that is largely because of workforce issues. I mean, when you look at the potential mitigations to deal with workload imbalances, then it's not just about trying to increase the numbers. It's about trying to utilize things like digital pathology, even AI if it gets going ever, and also looking at automation in histopathology labs, which is the big bit that hasn't really taken off amongst pathology. We've had automation in blood sciences for many years, if not decades, but there are little efficiencies that you could make there that would potentially make a difference. The other final bit is, looking at the wider workforce and looking at advanced roles of biomedical scientists. That will definitely be an area for expansion, but it will not be a big expansion. It will barely touch the sides. The final point I'll make about AI will not replace pathologists, but pathologists who use AI will undoubtedly replace those who don't. So it's important that we embrace AI as much as we can and make sure the training's there, make sure the competency's there, so that when it comes, if it comes and if the money's there, then there are people who can use it.
Yeah, I think again, if you look at the bits of pathology where we do a lot of stuff by hand, and I guess hematology, morphology, all the cellular pathology specialties, bits of medical genetics investigations, there's a lot of hands-on stuff there. If we look at CellPath, one of the things I think that we could look towards is creating tracks and not so much analyzers, but machines that produce a production line which is more automated than currently. There are things that are available, and we know that they exist. Some labs have them relating to things that both will embed or at least enable embedding, but will also do sectioning. And that availability is there, but we haven't got the space or the cash to utilize them. And so if we did that, then we would be able better to use the trained staff that we have. And I think, just in terms of how we address this, we tend to look at laboratories and laboratory costs as single cost centres, and we hear a lot about cost per test. I think it would be far better if we looked at cost per patient and the role of laboratories within that, and how laboratory investigations facilitate patients' progress along these pathways. In that way, we could see the relatively tiny financial outlay for a massive gain in terms of movement along that pathway, and indeed signaling and direction in terms of the diagnostic workup, the diagnosis itself, the potential treatments available, and then the follow-up across all the disciplines that we're talking. I'm not just talking cell path here, because every discipline's involved in all of these areas to varying extents. And so, you know, if we look at that and create a metric around that whole systems approach, I think that would be a very useful thing to do. And again, that's an area that industry could collaborate with us, because industry knows all the pieces of that, whereas we tend to know the bits that we know in relation to our own specialties. So there's a whole lot of useful stuff that could be done along that. And in a way, that would be a much more realistic way to look at what we do.
Yeah, I think there'll be a lot of agreement with that in terms of looking at things across the pathway and seeing the true value diagnostics brings to that. And within that, I suppose, yes, absolutely agree. I think industry can see some of the bits outside the lab as well, but it's also people within the system, within the NHS, who are working not just within the lab or pathology, but across the pathway to actually work together. And how, I suppose the question is, one, would there be a willingness to do that? Or secondly, how do we go about doing that and bringing the right people together to have those conversations initially?
Willingness, certainly. I'm sure there's willingness to do it. I think there's probably a need to socialize that idea, because if you need health economists involved in that, and the health economists, to my reading, I'm no health economist, but I've tried to read about it and find out. And the methodologies that are being used are really rather antiquated. And I did come across a recent paper which said that health economists need to be much more focused in their approach to laboratories, looking at a more sophisticated approach, which is specific to the sorts of things we've just discussed, rather than just looking at cost per test and implications per test. Because frequently, you know, the cheapest thing to do is not to do the test, because we don't then need to treat the patient as a result. So if we're talking about, you know, these sophisticated tailored medicines, they are expensive. But if we don't test them, then we can't use them. So that's the cheap way to do it, which doesn't help the patient at all, of course.
Exactly. And I think one of the things that, again, just going back to the report that was pulled out, is around things like technology, innovation and technology, but utilizing not just the technology innovation, but then also looking at transformation. And to your point, that transformation piece is so important, because there's a change element piece to this in terms of looking at things across the pathway. And if there is a willingness to do that, again, the question then becomes, who are the key players within that we need to not just socialize with, but engage with and get involved in this process. So I think that's, I suppose the question for me is, how do we go about doing that? Because a lot of this is, again, there's the awareness of some of these challenges, but really the how to and the delivery piece is so important. But how do we do that is the question for me.
Yeah, I think it's very difficult in the current, you know, atmosphere and funding cycles with government. You know, we've had a succession of reviews and plans, you know, 10-year plan and the recent launch of the cancer plan and so on. And, you know, they're plans really without a plan. There's no money behind them of any great magnitude. There's no real implementation plan set out. It's sort of a bit like Emperor's New Clothes, really, you know, and we all try and align to it, of course. But the bottom line for pathology is, unless we get that funding to, you know, promote innovation and promote the introduction of all the tech stuff that can help us, and unless we get funding and willingness to ensure we have proper training pathways for pathologists and scientists, then it makes it very difficult to create that turning space in order to make it all fit together and in order to restructure how we do things. So it's a sort of catch-22 situation, and that's why it's vitally important that the profession and industry come together with a stronger voice and really lobby hard, because when you look at the cancer plan issued today, it's got a lot of targets in it. 10-day turnaround time for histopath samples in 98% of cases. We're only sitting at just above 50% in the moment across England, and probably worse elsewhere. So it's a target that's absolutely not going to get met, and probably get worse. Unless we see that meaningful change in the ability to actually make things more productive.
Yeah, and I think this is where that whole partnership and collaborative approach really is going to be the key. And as you both mentioned, in terms of that industry engagement, industry bringing in some of that expertise, looking at, again, cross pathways, but then also looking at how we're bringing some of the innovations through is important, but working with the system to do that rather than just coming at it very much siloed in terms of not just the disciplines, but also the way they're bringing technologies to market. I think I've always advocated that working with a system is a lot better than actually sitting outside and then trying to push something in. And I think that's the key. But from both your perspectives, I suppose if there was one ask of industry from you guys, what would it be?
Well,
I guess,
apart from make your products cheaper, I don't know. I mean, it's difficult because the healthcare industry in the UK, arguably, there's not a huge amount of money being spent on it, and there's not a huge amount of new money being made available. So that puts us in a very, very difficult position. We're sort of painted into a corner in many respects, and that anything we do that's new, we have to stop doing something else. So it's really, really challenging. But certainly industry coming together, as I said, with the profession to really advocate for more pathology input and funding is one thing. But other than that, it's important that also there's discussion around ensuring the right products are pushed through, because up until now there's not been a huge amount of discussion at the sort of level of what products are going to be useful at the market end, rather than just doing something for the sake of it.
Yeah, I think that if you ask what's the one thing we can do, is at the meantime it's continue to talk to each other, because I think we're at a stage of looking very closely at what we're doing, and we are developing ideas about where we can do things better. And one of the things that I've seen before is that pathologists tend to know the sort of thing they want, and industry knows the sort of thing that they can do, but we need to have that interaction better as to what we want and what can we do together that will help solve the clinical problems that we're trying to mend for patients to provide the service that we are trying to do. And so the creation of opportunities to have forums to have those discussions, I think is probably a priority. I do think that the idea of looking collectively for funding, and it is, if you look at NIHR, for example, they do have strands, and they've published work where they're looking at different approaches to how you manage clinical problems. And one of the things that we could do collectively across the sectors, and I think that would provide it with strength, is looking at how we could, for example, develop metrics around whole patient pathways rather than simply individual testing. And I think, clearly there would need to be health economists involved in that. But I think that those are the sorts of novel approaches that I think we could do on the basis of a relationship of understanding, well, we can do this and we can do that, but we need all these other sorts of people to do it. And I guess my experience of research projects and programs in certainly the recent past is that, the idea of the man and the boy going about doing it is no longer tenable, and you need loads of people, each of whom bring their own special capability into a project. And if you can pool all the right people together, then what was a massive and unmanageable task becomes suddenly doable. And not only is it doable, but it achieves, and you can, produce good material out of it. The difficulty is always getting traction, of course, from that good material. But I think, part of the strategy is building in the communication angle into that. Who are you aiming for? How are we going to use this data to answer questions that other people will listen to, rather than being, focused on abstruse issues that relate to us solely? It's sometimes thinking outside the box to what is the application of this, which then allows you to couch the research question appropriately at the beginning. So again, it's having the whole system in front of you when you start thinking about things that I think is important. And the more we can do that, the better.
Yeah, no, I absolutely agree. And I think one of the elements to this, and again, from some of the experience, some of the projects I've been involved in, is looking at the whole system approach. And the key elements, particularly when it comes to medtech diagnostics, is also having, as you mentioned, Peter, what's the end goal? What are we looking to do? Is having individuals within sort of commissioning and procurement also involved in those discussions, because they'll have specific things that they're looking for. So when we're either generating the evidence or bringing the data, what data we need, it's the data they also need to make the decisions around procurement and commissioning. And I think that's sometimes the missing piece, but how do, it's important that we work with them. And again, to your point in highlighting, the health economics piece is critical within that.
Yeah, if I can add just a couple of comments that are related. I mean, I think it's important that, the products that industry bring, whether it's analyzers, new tests, or tech, LIMS, order comms, they have to be more refined and more fit for purpose. It's not because only when you get products that are going to actually be game changers will you actually get business cases that make sense, and that makes it more likely that they will be introduced. So in pathology, it's not so much about increasing productivity, it's about keeping up with the demand on the services, with the capacity we've got. And one area that is going to be even more crucial in the future is diagnostic stewardship and demand optimization, where we can't keep up. So we've got to actually ensure we're doing the most important stuff. And at the moment, the sort of tech industry around that is very, very poor. The functionality of order comms and LIMS just isn't set up to do even the basic stuff. And there's been a resistance, from that part of industry to actually, move towards that. And I guess it's because in other parts of the world, especially North America, it's something that doesn't go down well, and it's not a functionality that people would want to do less testing, but in the UK, I think we need to reduce unnecessary testing in order to focus on the necessary testing that's going to increase productivity outside of pathology and across the patient pathways.
Well, just conscious of time, and we're at time. Just want to say thank you both for your time today. I'm sure this isn't the end of discussions. This is just part of the overall discussions as we go forward. And I'd also welcome the opportunity to maybe have this conversation or see how we've moved on with these conversations, maybe later on in the year as well, and seeing how we've actually moved the dial, if we've moved the dial, and what are the things that we need to be doing going forward as well. Because again, this is not static, it's not one time, it's a continuing process, and some of the challenges that we have